So, as a physical therapist, it'll be very important for me to understand my variety of patients' disabilities, illnesses, and injuries, or surgeries that they're recovering from. So, this is just a scenario of me explaining kind of like notes about what my patient has and all the things I can correlate with my patient and their disease, disability, so that I understand how to best rehabilitate them. Physical therapists help rehabilitate patients from a variety of illnesses, injuries, and surgeries. Amongst these is a disease called muscular dystrophy, which is a group of inherited diseases in which the muscles that control movement progressively weaken. There are 9 forms of muscular dystrophy, and my patient has Duchenne's muscular dystrophy, which results in progressive muscle weakness and deterioration. Muscular dystrophy is often diagnosed by an electromyography, genetic testing, lung monitoring test, or an electrocardiography. My patient also has suffered from cardiomyopathy due to significant cardiovascular involvement. People with muscular dystrophy, since their muscles are working that much harder, the muscles in their heart also work that much harder, which has them often develop cardiomyopathy. Another symptom my patient faces is scoliosis. Since this is a congenital condition, many people who suffer from it develop a lordotic curve in their spine, which eventually leads to a lack of ambulation and then causes scoliosis. Weakness of muscles affects an individual with muscular dystrophy in every muscle of their body, including the respiratory muscles. Often, people with muscular dystrophy will have to use a ventilator to pass air to the airway. People with muscular dystrophy may also have trouble swallowing due to the muscles used and could develop aspiration pneumonia. As a physical therapist, it is important for me to understand each of my patients' abilities or disabilities and what the common symptoms are, because it allows me to help them to the greatest extent available. It is also important for me to be able to educate my patients with muscular dystrophy on ways in which they can be more proactive by staying physically active with range of motion and stretching exercises.